Hello. Today I would like to talk about one of the most interesting things you find in elderly fear. Fear is not an absurd thing in elderly. They genuinely fear about doctors, genuinely fear about hospital visits. They genuinely fear about any blood test or any test or investigation being done on them. They also have a fear for going out of the house. Okay. Then comes the fear for standing, the fear for stalking, walking, the fear of fall. Okay. So many factors add up to this feeling of fear. Okay. Initially, one of the most important factors I would blame is uh, that whenever they have to go to the hospital or clinic, okay, they find that they are waiting for a long time, and in the end they find that they are not really satisfied with what happened in the hospital. Okay, see, it's something like most of them feel that, okay, even though I went and waited for a long time in the hospital, though they gave me medicines for so long, I don't still don't have any big relief. Okay, so this creates an aversion for hospitals and clinics and all these things. The next most important factor is the pricking. Whenever they go to the hospital, they are pricked for blood samples. They are pricked, made to run here for X-ray, run there for ECG, and things like that. So this running around the hospital, making them wait, and all these things add to the fear factor. Then the possibility of admission, the possibility of surgery. So all these things add up to their fear and cause them to panic when the word hospital is told. Similarly, okay, the next factor will be people around them, okay, or the stories they hear about people around them. Like, for example, someone in their 80s, okay, has a lot of siblings or friends or relatives in that same age group, has a fall or has a stroke or has something like that, okay, automatically, or someone passes away, or even that can create a negative impact to them. So they will also tend to relate with them. They will say, oh, even I am of that same age. See, this the same thing can happen to me also. Or if someone has been diagnosed with a cancer or a kidney disease or something like that, they always think that they are also going to develop the same problem. So this creates a impact in them, and a negative impact in them actually. So it causes them to avoid walking, avoid doing anything which might cause the injury or impact. So all these factors are put on together gives the elderly a chance to go into some kind of cocoon like structure where they feel, no, I'm comfortable in this place, I will not come out of this place. So that is how most of the time when I go home and see patients, I start talking to them, I realize that they are inside a cocoon. So it really, so they are reluctant to come out of that space. They are reluctant to come out of that you know enclosure. So and so when I have to bring them out, I need to coax them a lot, talk to them a lot. So they are initially frightened at first when they see me. The first reaction that I always hear when I go to a patient's house, is, "Oh, I know I'm completely fine. I'm completely normal. I don't have any issues. I don't know why my son called you." So that's how the whole conversation begins. Okay. So it means that the patient refuses or denies having any problem. And in the end, when you start analyzing the problems, you find a big list of issues coming out. Okay. So all this starts with that small fear factor, which over a period of time it starts ballooning and ballooning, and finally it creates completely occupies the patient's mind and does not have space for the other systems to react. Thank you.